You're listening to the Innovation in Healthcare podcast produced by Health Innovation Northeast and North Cumbria, which supports the health and care system to accelerate innovation, to improve people's health and the regional economy. Professor Dean Fathers is the chair of Health Innovation Northeast and North Cumbria, and he recently attended a trade mission to Romania, organised by the RISE Institute. In this episode, Dean leads a conversation with Dr. Dawn Price and Jonathan Rowley, who are also part of the trade delegation, and they share their learnings on how internationalisation can improve and benefit innovative healthcare in our region.
Hello, my name's Dean Fathers and I'm privileged to be the chair of the Health Innovation Network for the North East and North Cumbria region. And I'm joined today by Dr. Dawn Price and Jonathan Rowley, who are from Mistura Informatics and North Tees and Hartlepool NHS Foundation Trust, respectively. Hello, both of you. And before we start, Dawn, Jonathan, I wonder if you could introduce yourself to our audience by telling them a little bit about you and what motivated you to do the role you have currently.
Oh, yes. Hello, Dean. Yes, I'm an ex-NHS chief pharmacist by background and a non-medical prescriber. My background was mental health. With over 30 years clinical experience, but always was finding challenges in providing simplified information to people about their medicines, and particularly where there was communication challenges. So I developed a company and some systems to try to address that gap, to improve safety, reduce harm, and I'm the co-founder and managing director of Mistura Informatics.
Thank you, Dawn. Jonathan?
Hello, thank you very much for having me today on this podcast. As you've said, I'm Jonathan Rowley. I'm Head of Innovation for North Seas and Hartlepool NHS Foundation Trust and its subsidiary, NTH Solutions. And really, the purpose I get out of my role is around making a difference. What I really want to do is come across ideas, innovations, ways of doing different things, if it has to be a different way of doing it, that can really help patients and improve lives. That's what I want to do. That's the motivation, and that's what gives me the purpose to, I guess, get out of bed and come into work every day. It's an exciting way of working as well, working with new things and hearing new ideas, but it's that motivation to find something new that will help people in their lives that really drives me forward.
Thank you, Jonathan, and pleasure to meet you both again. We've obviously met before because in April last year we had the opportunity to go to Romania. John, just in terms of pick up on your introduction, what motivates you? You know, North Tees and Hartlepool NHS Foundation Trust, they've set up something which is different to the majority of other NHS trusts. You mentioned NTH Solutions there. Specifically, what is its mission and what is it trying to achieve?
So NTH Solutions is not alone as a subsidiary of an NHS trust. Ours is set up primarily as an estates and facilities function. But what attracted the trust to set up NTH Solutions as well as that was this idea of having a pipeline of innovative ideas that we could invest our time, efforts and some money, if it's a good idea, obviously, and take it through that innovation pipeline from concept to reality, and then make it happen, see it adopted into hospital trusts and then commercialize it. So that commercialization function of NTH Solutions is the bit that makes us really different, and at this point fairly unique.
Thank you, Jonathan. So again, I can see why now that would be something that would be wanting you to go on a trade mission to Romania. And Dawn, if I can turn to you then, you know, we've got a lot of talk in the system at the moment about the importance of informatics. So what exactly is informatics and why is it important, please?
It is, because I think from setting up a company to provide information, simplified information about medicines, it needs to be put into the context of the NHS. I mean, most important health intervention for whether it's disease prevention or treatment is prescribing of medicines. And that's a lot of money when you talk about, I think it's 19.2 billion spend this year. It's gone up 8% on the previous year. Chronic disease prevention, it's all about medicines. And it's the second biggest cost to the NHS after the workforce. But the problem, I mean, it's a global problem from the World Health Organization's perspective, not just the UK, is half of people don't take them as they should, despite billions of pounds in evidence base to show that these medicines are working. And if people don't understand their medicines, can't take their medicines, literally they won't get the benefit. It means more appointment time. Me as a prescriber have to see them more, wasting medicines. And not just that, I mean, from the point of view of thinking about workflow in a very busy time when practitioners are dealing with patients, it's, you know, you want to make sure they're getting the best possible treatment, but understanding is at the core of it.
Thank you, Dawn. So you mentioned globalization in that conversation then. Obviously, this is a major market opportunity for you. So what particularly attracted you to want to go to a trade mission to Romania?
I think I've got an experience because in the past I've developed a system for a mental health service where we kind of grew organically, providing information on mental health medicines. There's only about 175 medicines, and pharmacists and doctors who'd worked in the UK went off to Australia and New Zealand and decided, oh, this was a good system. So we kind of provided it to them and translated, for instance, to Maori. But the thing was, it wasn't organised, and becoming part of a trade mission where you can, you know, be introduced to the right people and understand the infrastructure from a perspective of a business being able to validate. For me, it was the ideal opportunity that came along at the right time. And of course, medicines is the same all over the world, slightly different names, but they are the same medicines. And we had Romanian on our system, so it was perfect opportunity. Thank you, Dean.
Thank you, Dawn. And Jonathan, what about you? What attracted Romania to you at NTH Solutions?
Well, for a start off, it was obviously a fairly unique opportunity as a team that is fairly new to at all. We really wanted people to know that we exist, and when this opportunity came around, it was something that we felt we couldn't miss out on that opportunity. If I'm honest about it, we wanted to be out there, known and understood. So we wanted to be part of that journey of discovery for innovation, and we wanted to collaborate. So we were keen to understand Romania and its problems, the trends for what the businesses, hospitals, universities, what were they all trying to learn and do to innovate, and what technologies were being harnessed in digital health there. We knew that in Cluj there's a really big digital zone and a lot of capability there. So we were interested to get to know people, to understand the visions. It's really about those trends, understanding what people are trying to strive for and how we can help. The key is how can we help as well. I've said this so many times, but we really want to help those companies, those organisations and innovators who've got a really great idea, but they need help bringing it to fruition. And the more places we can get out to, and the more people we can meet to help, the better chance we have of accelerating healthcare innovations. That's the key for going anywhere, really. Romania is a fantastic place with a great culture, and we loved being there, but that's just the start for us.
That's okay. So looking back, I mean, you've obviously both been now. You had high expectations. You certainly recognised the potential of the country to add value to what you're trying to do, and you to add value to what they're trying to do. So looking back, how did the trade mission match your expectations? What did you achieve, and what have the subsequent benefits been? John, do you want to go first, Jonathan?
Well, obviously, we were there for 3 days, and we met 3 distinct groups. We met hospital leaders, which provides us with a deeper understanding of the challenges and opportunities within healthcare in Romania, and that gives us perspectives that help us identify areas where an innovation can make the most significant impact, and we can either help them with ideas, or we can begin to search for a solution to a problem as a result of that. And then the academic, the visits to universities, we know they're a breeding ground really for cutting edge research, development, and being able to engage with those leaders and researchers, that opens doors to collaborative projects, and we want to, as I've said before, we want to be a part of that. Those partnerships, they can really lead to some groundbreaking discoveries and developments for healthcare solutions. And then moving on to the businesses and the medtech industry. Yeah, if we can connect with the leaders in that field, which is what we did, it was fantastic for that. But we just gain more insights into those trends, technologies. It builds on capacity to innovate and scale things for a broader population.
Thank you, Jonathan. And Dawn, what about you?
I think for me, as mentioned by Jonathan, there was hospital leaders and academics, but I think I had a dual perspective. One as a clinician, because essentially one of the hospitals, the neuro rehab hospital, I was able to see some patients and some of the facilities, equipment, talk about some of the medical treatments, which was very, very similar to what we have here in the UK. I had a background because my husband had a motor neuron disease, so I understood that element of experience there. And talking to the patients, I was surprised actually how well they spoke English. I was expecting it to be much more difficult to communicate. And as you say, engaging with these hospital leaders and wanting to excel and digitize. Again, from the academic perspective, I spoke to, pharmacy, schools of pharmacy, the dean from the most prestigious medical school. And from me, and when we've worked in the Australia, New Zealand culture, our systems need validation. So it tends to be, based on cultural, religious backgrounds, ethnic variations. So to be able to speak and actually see these people and discuss what we would need to be able to bring our system into Romania was massively important, not just emails and text messages, which, you need the face-to-face. And I think the other thing is the power of the social enterprise, RISE itself, being there to facilitate, know people, the briefings before, the wash-ups after, for me, was really important. I have done Department of Trade and Business meetings before, but this was excellent. It excelled my expectations and also the experience of what I've had before.
Thank you, Dawn. And so, you're both really experienced healthcare practitioners, leaders in the system. And now you've had this along with other experiences that you've had on other trade missions. For those listeners who are thinking about going on their very first trade mission, what advice would you give to them to make sure that they gained the maximum value from their trade mission experience?
It's about the interactions with this trip. Specifically, there were really meaningful connections that we gathered. I'm not sure really if that was the way that this delegation was set up, but we really gathered some really trusted relationships from attending this, and I think that's really key. That we were not just there to exchange business cards. We wanted to really build really good relationships. And Yeah, I mean, I think more people should really be involved in this kind of thing, specifically because we want to meet them as well. We want to create a network of innovators, people who share that same common goal of improving healthcare. And the more people that can get involved and be part of these trips, it would just be fantastic to meet more people. Yeah, it just makes sense to do it.
Thank you, Jonathan. Dawn, what about you? What could you share?
Probably three things, Dean. I think first is to understand the culture. The first thing that I noticed was, particularly in the leadership roles, was how many women were there, and understanding the background and the culture of Romania itself was, it sort of put it into perspective with these, understanding what had gone on and previously and where they want to be, and how they are working across Europe and with other organisations, was just fascinating. I think the second thing for me is knowing who you want to meet. One thing that was pretty overwhelming for me was when we had the innovators, as in some of the health tech companies who were wanting to meet us. We had a few minutes and it was just massive overload of what people were offering and what we could give. But to me, knowing who you want to meet is really important. Otherwise you can get lost in that overwhelming overflow, because it's absolutely amazing the response that you get. You might think that you're working in silos, but really, when you've got these trade missions, you're not. And I think for me, the third one is the network who you're going with, because as I've said, I think Jonathan and myself have met quite a few times. We've got collaborations going on. I have with James from Glum, who was there with us, who's helping with things that we needed to be done. And we've got collaborations that have evolved from the network of companies that attended. So, the one word I think I used was reinvigorated, and not to be feeling as if I was working alone.
Dawn, thank you very much for that. Jonathan, thank you very much for that. Your insight and your inspiration and your motivation has been uplifting and of value, and I've enjoyed listening. Hopefully our listeners have been appreciative too. You've been listening to Dr. Dawn Price of Mysterio Informatics and Jonathan Rowley from NTH Solutions, and thank you for listening.
Thank you for listening to the Innovation in Healthcare podcast, produced by Health Innovation North East and North Cumbria. If you'd like to find out further information about how we are supporting economic growth in the North East and North Cumbria, you can visit the What We Do section on our website, healthinnovationnenc.org.uk. We will of course provide further links and resources in this episode's show notes. Thank you again for listening.